I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Sheshadripuram, Bangalore. I'm also the Founder Director of Aviksha, a home-based primary care. My expertise is in HIV, palliative care and geriatric care. Planning a pregnancy is like in any individual, whether a person is HIV positive or negative. But the most important thing is, if the couple is positive, they should undergo proper treatment and a viral load detection so that their viral load should be undetectable. If their viral load is undetectable, the risk of transmission of infection to the unborn child is negligible. And with this, the couple can proceed to have a normal pregnancy and a normal childbirth. So it's important that the couple should see their HIV physician at the earliest before they plan for a pregnancy. We usually ask our couples to get tested, get their viral load tested, and if it is undetectable, they proceed further for planning a regular pregnancy and do not need to undergo in vitro fertilization or artificial fertilization. They can proceed further to have a normal pregnancy and a normal delivery.